So good morning, good afternoon, everyone. Thank you for joining the CESI at noon on youth mental health. I am here together with the honored panel of participants and specialists on youth policies, mental health issues, workers' organizations. And I would like now to wait a few more minutes if you agree, maybe 1 or 2 minutes for the other participants to join, and then we'll kick off this discussion on mental health following the pandemic. If you just allow me to briefly present to you the first speaker, um, Manon Desele. Manon, please help me with your pronunciation.
It's
You
okay.
represent the European Youth Forum, who was one of the pillars of looking into the mental health of young participants, young youth council representatives, and so on during the pandemic. And they wrote a very important a report on this, looking at what happened follow the pandemic, how the mental health of young people developed during the lockdown and beyond. So now I will give you, Manon, the floor, and please introduce to us your main findings and the position of the European Youth Forum on this issue.
Thank you very much, Raluca, and hi, everyone. So I'm very happy to be here. Thank you for the invitation. As you were saying, the European Youth Forum, we're a youth organization, and we have members all over Europe, so more or less 100 organizations, representing really millions of young people. And so what we did was we published a report called Beyond Lockdown, the Pandemic Scar on Young People, because we realized really that the pandemic was having a very strong impact on young people, and you wanted to see really what it was more detailed. And so it looks at this impact in 3 different areas, if I can say. So their income and their work, their education, but also their mental health. And when we looked at the mental health really through both data, but also qualitative research, as we had some focus groups and some interviews with young people, we saw that nearly 2/3 of young people may be affected by mental health and well-being issues. And that was very troubling, of course, when we saw that. And then, of course, through our work, continuing work in general in 2022 and our collaboration with Mental Health Europe in some aspects, and I'm sure Fatima can say more after. But we realized, that really mental health problems among young people have doubled in 2020, 2021. They are a very vulnerable group in general, and they were very likely to report experiences of depression, of anxiety, much more so than adults. And of course, that's only looking at young people as a group, but as we know, young people are not homogeneous. There's a lot of diversity. And so when you looked more at the detail of young people, you would see that young women were more affected, young people from marginalized backgrounds were more affected even so by those mental health issues and well-being issues. And so why was that happening? Of course, because it was a very uncertain situation for young people. Many young people lost their job, were not able to continue their education, or were in a very uncertain situation, lost their income, lost their independence. Even many young people that used to live on their own had to go back to their parents, which might not have been a safe environment for them. So there were really a lot of root causes to those mental health and well-being issues that were to us very important to look at, because it was very revealing, actually, that there's a very strong link between someone's mental health and well-being and their socio-economic environment. If you don't have a good housing situation, if you don't have a good employment situation, then that's going to have a very strong impact on your mental health. And that was for us kind of the angle that we thought we could look at mental health through, especially for young people, and where we could have some expertise and add some added value in the work and in the research that was happening. So we were really trying to have this sort of a comprehensive approach to the issue, and also looking at the potential long-term effects that it would have had. So when talking more about, what to do as the Youth Forum and the recommendations we would give to policymakers, and I'm happy to do that more in detail later in the discussion also. But again, it's all about the comprehensive approach. It's all about looking, making sure that, of course, you have quality services for mental health, that you have access to those services, that they exist, that the young people can reach out to them, that all the young people, can have access to a psychologist, whatever. But that's not enough. And you need to look at it through really addressing all the root causes, as I was saying. So it's about making sure that we address the employment situation. And so it's about making sure that you have quality employment, that you have, not temporary jobs, but long-term jobs, that you have a good income, that there are solutions for the housing crisis. And I think, of course, at that time, when we did the research in 2020, 2021, we were looking at the impact of the pandemic, but now you need to look also at the, well, I was going to say upcoming, but it's already there. This cost of living crisis is very much linked to the impact of the pandemic, and is having and will have strong impact on young people that have not even recovered from the previous crisis. All those young people that cannot afford their energy bills, that doesn't help. And that means you have, your mental health and your well-being is affected in a very negative way like this. And so we need the government, we need the decision makers, we need the EU to make sure that all those issues are addressed with a very specific, youth perspective, but also gender perspective, as always, to make sure that the general living situation of young people improves, and therefore their well-being and mental health will improve. And so, we were very happy to see the President of the Commission in her State of the Union talk about a comprehensive approach. We're waiting now for more details. I think we're all very impatiently waiting to see how it's going to really be developed. And we do really hope that youth organizations will be very much involved in this, even though it's not the European Year of Youth anymore. I think that's something that should always happen. So we have some hope, of course, and we'll continue on pushing for that approach on our end. And I think I might stop there. So I'm sure to be in the 7 minutes. Yeah. Happy to come back after.
Thank you very much, Manon, for this introduction and for this emphasis on placing mental health in a comprehensive approach on socio-economic integration of young people in the job market, on the educational sector, and in all the policies which affect them. I will now give the floor to Esther Shandor, representing Eurofound. She will try to be brief and to share with us the findings of 5 research exercises, if I'm not mistaken, Esther, which Eurofound prepared during the pandemic through this Living, Working and COVID-19 series. And she will focus on the research looking at young people and mental health during the pandemic. You have the floor. We already see your PowerPoint, Esther. Thank you for being with us today.
Thank you very much for the invitation. I hope you can hear me well. So here at Eurofound in Dublin, when the pandemic started, we started a series of online surveys because we were unable to do our usual data collection, the quality of life survey and working condition surveys. And we noticed in the data that it was, while young people were less affected by COVID, the virus, they were definitely more affected by the employment impacts, the educational impacts, affecting their ability to build social capital and eventually affecting their mental health. And we know that there was an unemployment shock that really impacted young people more, and this was because they were more likely to work in those sectors that were closed down, and they were also more likely to have temporary employment and easier to dismiss as businesses closed. And luckily, this proved somewhat short term, but the longer term impact was more about mental well-being. And another reason why this happened was the disruption to education, leading to learning loss. There's more and more studies on trying to measure the learning loss that occurred during COVID. And there was a huge inequality in the access to online learning and the support available due to this digital divide in Europe. Then when we were asking students how much they enjoy their online education. Unfortunately, over half said that they definitely don't want any more online education after the pandemic is over, and it was not a positive experience for them. Another very important reason behind the mental health crisis was insecurity, which was kind of multidimensional. There was the housing insecurity mentioned by Manon as well, and the job insecurity. These have decreased as the pandemic progressed. So in 2022, it was lower. But a new question we had to include in 2022 in the survey was energy insecurity. So the worry that you will be unable to pay your utility bills. And this was very common with a quarter of young people worrying about this and also having difficulties making ends meet. Looking at more mental well-being, so we measure risk of depression, so not actual depression, but a risk based on mental well-being score. And this was like unprecedentedly high compared to our previous surveys. This was due to what was mentioned before, the isolation, family tensions, having to move back with your family, and especially the uncertainty about the future, insecurity of employment and education and housing. And this was closely related to the strictest of lockdowns. So the longer and the stricter the lockdown, the more risk of depression among young people in each country. And we showed that that it was especially school closures among the measures that had the strongest negative relationship with mental well-being for people under 29. When you look at previous data before the pandemic, even though you can't directly compare because these were face-to-face surveys very differently measured, you could always see that negative feelings such as feeling downhearted and depressed, loneliness and anxiety were more common among older people, and this completely reversed in the pandemic. And it was always young people who were more likely to feel this. And even in 2022 spring, even though the lockdowns have ended, it didn't ease off at all. And this may have been linked to it coinciding with the war breaking out as well, especially when it comes to anxiety. And I want just a very tiny summary of our qualitative research, where mental health professionals in all countries really highlighted that this was such a severe problem, and there was so much urgent need, but it was impossible to provide mental health help online. And it was especially, once again, the most vulnerable who were the most hard to reach. And just a warning that this has not yet returned to pre-pandemic levels, so mental well-being, and this can continue to be a barrier to return to the labor market and education. That's it. Thank you very much.
Thank you very much, Esther. I think you pointed out some very important effects of the pandemic on the youth mental health, and maybe for the question and answer phase of the event, people will be able to address you more questions, more in-depth questions about your findings. I'm happy that people already have started to use the chat to communicate. I will share there all the reports that will be presented. But now I will give the floor to Fatima Awil, who is representing Mental Health Europe today, and who has worked intensively on some key recommendations around the urgent need for young people mental health to be taken into account following the pandemic. So Fatima, you have the floor. Please also introduce your organizations, the same as your previous predecessors introduced, and we look forward to your comments.
Fantastic. I hope you can all hear me well, and thank you for the lovely introduction. So I will briefly introduce Mental Health Europe for those who aren't aware, but my name is Fatima Awil, and I'm the Policy and Knowledge Officer at MHE. Mental Health Europe is an organization, a European network, and the largest independent network organization representing mental health users, professionals, and service providers across Europe. And we have over 70 members in over 30 European countries. Prevent mental health distress, ensure support and advancements of the rights of persons with mental ill health, or psychosocial disabilities. So these are some of our focus areas. And in my intervention in the next couple of minutes, I will talk about a number of recommendations we've put together, which just need to just go on to the next slide. So so Manon and Esther have both talked about some of the statistics and important data around young people's mental health and COVID. And we know that 1 in 4 people will likely experience mental health problems during their lifetime. And data and statistics have shown that poor mental health and mental health problems have been growing amongst the general population since the onset of the pandemic. And experiences of anxiety and depression have been estimated to increase by 25% globally during the first year of the pandemic. And in terms of cost, the World Economic Forum projects the cumulative cost of loss of productivity due to psychological distress and mental health problems during the period of 2020 and 2025 at $114 billion, which is really eye-opening, certainly. And already before the COVID problems amongst young people aged between 15 and 25 have doubled in most European countries, as Manon explained earlier. But we know that lockdown measures and restrictions have had an impact on things like adequate education and access to quality employment. And with the ongoing political and environmental uncertainties, will likely have an impact on young people in Europe. So what we really need is a mental health system change. So joint action to ensure prevention of mental health problems, meaningful empowerment and active engagement of young people in decisions around their mental health, but also targeted support at every stage of their life. So especially during as recommended by around that. So in regards to focus on prevention, we call on a number of things. So integrating and monitoring mental health in all policies, and this is essential to ensure that mental health is adequately integrated in all relevant areas. Also implementing a holistic approach to mental health. So this includes focusing on social rights, economic protection packages, and targeted supports. And mental health is, as we all know, a cross-cutting issue, a cross-cutting topic, and that really truly requires a holistic approach. And alongside that, investing in mental health literacy, so really looking at mental health being integrated into the school curricula, and also training for teaching staff and professionals is important, and ensuring that this training and education is comprehensive, long-term and continuous. And in relation to this, providing skills and resources to recognize mental health risk factors. So in relation to this, understanding also how to provide concrete support and signpost is critical. And in terms of crises and emergencies, taking into account and including mental health protective factors is really important. So these are some of our recommendations in relation to prevention. So on to empowerment and engagement. And this is really important, especially because young people, and this is in relation to any policies impacting a particular group, they really should be centered in these processes. So ensuring mechanisms to meaningfully and continuously engage young people in policy and decision-making is critical. And also allowing and ensuring the engagement of young people from diverse backgrounds with a specific focus on young people from disadvantaged situations and living in severe exclusion is really essential. And this is connected to outreach. So outreach strategies and processes should ensure at minimum that the most marginalized are reached, so that their perspectives are really integrated into these processes. And we always say that if the very communities aren't involved and centered in these processes, then the end result won't necessarily reflect their needs or be as effective as it can possibly be. So this is very important. Alongside this, developing and supporting awareness-raising campaigns on mental health, human rights, and ending stigmatization. So ensuring that we normalize talking about mental health and opening about mental health and what that includes. And also supporting the essential role of youth organizations in providing support, information, and services. So we know that youth-led organizations are extremely important and often don't receive adequate funding, although mobilization on the ground is effective and really progressive. So this is definitely needed. And just to finish off, I want to briefly mention that targeted support is also essential. So investing in tailored support that really reflect the needs of the person throughout the life cycle, ensuring that services are catered to specific needs and that they're person-centered. So respecting human rights and mental health requires a person-centered response based on people's unique identities, ensuring that support is affordable and accessible to all young people, that they're better coordinated and holistic. So this is related to an integrated approach to mental health and community-based services. We've seen during the COVID pandemic, for example, that community-based services were really effective in mobilizing support for communities. So ensuring that they're really supported and valued and prioritized. And then lastly, around research and better data. So we need a better understanding of the situation around mental health on the ground. And so we need continued investment in that. So I will stop here, but I'm happy to answer any questions or build on any of my points later on. Thank you.
Thank you very much, Fatima. This was a very comprehensive presentation. We thank you a lot. And let me remind our audience, which is now composed of over 65 participants, that we will have a question and answer session for the end of the meeting. So far, we have discussed in which way young people have showed increased signs of mental distress following the pandemic. We looked at the research conducted in the EU, but also the speakers referred to data provided by the World Health Organizations about the mental well-being of young people, which have been seriously affected by the socio-economic conditions of the pandemic. We looked at what could be done through Fatima's comprehensive presentation. But now I would like to invite also the representative of EACHA, which is the European Agency for Education and Culture, who also conducted a research on the effects of the pandemic on young people's mental health in different countries. And then we will try to see what solutions, how we could achieve this comprehensive approach on mental health and how this could be addressed through all sectors of policies. So Giulia Paolini, EACHA's representative, is now with us. I will share now with you the report they just published this year in spring, and you have the floor to walk us through this policy responses to see what actually happened at the member state level and how the impact of the COVID-19 pandemic on mental health has been mitigated. So,
thank you.
Giulia, you're with us. Thank you.
Thank you. So yes, as you said, we have conducted this research through our network of national correspondents covering about 32 countries in Europe. And we have collected information on what have been the policies that have been put in place in the member states and other European countries to counteract the impact of the pandemic on the mental health of young people. So I will not go through, of course, the first part of our research, which is about the impact of the pandemic. The previous speakers have already given us a very thorough overview. I will just jump into the main results that we have obtained from our research. Just to mention that we have covered 2 years from March 2020 to March 2022. And the results that we have obtained, and I will go back to this at the end of the presentation, have been the identification of main trends and approaches in the response of the member states and European countries, a collection of good practices, and suggestions for the future in the field of youth mental health. So here is one of the maps that we have developed, and you can see that it represents the countries that have conducted studies on the impact of the pandemic on the mental health of young people. You can see that the vast majority of countries in Europe have addressed the problems at the beginning of the pandemic. And about half of these countries have also used the results of these studies to formulate policy measures. Mainly the topic of the studies has been, for example, the impact of school closures during the pandemic, and also the impact that the pandemic and the lockdowns have had on the activities related to youth work. We have then looked into the different policy fields that have emerged as those that have been mostly addressed by the actions of the European countries. You can see that the vast majority of countries have introduced measures to help young people in the field of mental health care, many also in the field of education and information. Less so has been the case for youth work, leisure, and sport. And here, just a parenthesis to say that these last 3 fields are usually more difficult, let's say, to be targeted by policies, national policies at the central level. Normally, the measures that are most effective are those that are taken at the local and regional level. So this is also why, as we looked at national policies at the central level, these fields appear to be a bit less addressed. So here we have a look at the number of countries that have introduced measures in the field of mental health care, and you can see that the vast majority of countries have done so. Now I will not go through in detail the different measures that have been introduced, but I can give you some examples. For example, there have been more funding in mental health care centers to provide, for example, counseling to young people, to provide helplines, also using digital infrastructure, and also to promote instruments of self-help, for example, apps. As well, in the field of education, a vast majority of countries have also introduced the measures. As the previous speakers have underlined, this has been one of the fields where young people have been most affected negatively by the pandemic. And some of the examples of these measures have been, for example, the creation or enforcement of psychological support in schools, sometimes also in partnership with the national associations of psychologists and psychotherapists. Also, several activities have been organized to help students who have been left behind in their study curriculum to catch up, for example, during summer 2020, summer 21, there have been many examples of summer camps, for example, to help young people gain the knowledge that they have been a bit missed during online education. And also efforts of digital inclusions have been made in several countries to allow young people to stay connected in the school environment during the lockdown. The field of information has also been very important. We all know how young people use social media and how they can be exposed to misinformation, for example. And during the pandemic, this has been quite a strong problem, not only, of course, for young people, but in general for the general population. So many countries have also introduced measures to give young people objective information on the pandemic. There has been a high use of social media, also, for example, through influencers in many countries. the creation of online workshops with experts to inform young people also not only about the pandemic, but also the risk that lockdowns could have on their mental health, and refer them to possible solutions and services around them. As I said, we also looked at the field of youth work. Unfortunately, youth work, that is one of the most important elements in the for many young people for socialization, participation, and social inclusion, has been quite impacted by the pandemic. So many activities have been suspended. And from this map, you can see that not many countries have actually taken measures at the national level to foster youth work. Again, I want to stress the fact that the situation at the local and regional level could be different. And mainly the actions that have been taken at the national level have been either financing youth work associations to continue to provide activities during the pandemic, and also training of youth workers, for example, in digital media, in order to be able to reach out young people during lockdowns. In the field of leisures, also some countries have created activities. And often these activities, for example, again, summer camps or other holidays opportunities have also involved the families and the parents, so that they would create a network and of support for young people that goes beyond young people themselves, also to integrate families. And then the field where the least activities have been promoted is that of sport. Although the countries where the measures in the field of sport have been introduced have done it a lot. For example, with exceptions into the closure of public spaces, many sport centers have remained open and financed through the pandemic so that young people could still attend. Another aspect that we have looked at is the different groups in the youth population that have been targeted by policy measures. As it was said also before in another presentation, the youth population is not homogeneous. So we can see that the group that has been targeted the most by measures has been that of young people with pre-existing mental health issues that have been very much prevented from accessing the services that they usually were in need of. Also, young people from disadvantaged backgrounds have been one of the target groups that have been mostly targeted, migrant and refugees. While young people living in remote areas and LGBTQI+ young people have been less identified in the measures that were introduced. So the main findings and recommendation that we can draw from the study we have conducted is that there have been a proactive response by countries to different levels, of course, to different degrees, country by country, and also depending on the policy field. But in general, we can say that there has been quite an awareness of the problem of the mental health of young people during lockdowns. Some vulnerable groups have been addressed more than others. So for sure, there are some groups in the youth population, and this is not only referring to the period of the pandemic, but this is also in general, are identified less by policy measures to support their mental health. Of course, it is evident from our research how the nature of youth mental health is cross-sectional. So it cannot be only targeted through medical healthcare, but is a mix of many elements that contribute to the well-being of young people. And again, in the previous presentations, you have touched upon employment, for example, social inclusion, participation, all elements that help young people have a high level of well-being. And our strongest recommendation from this study is that the measures that have been implemented and piloted during the pandemic should be continued. So they should not remain ad hoc measures just during the emergency of the pandemic, but they should serve as good practices and examples for the future. Thank you. I hope I was quick enough. I didn't want to take too much time, and I'm happy to respond to your questions at the end of the presentations.
Thank you very much, Julia, for this very, um, let's say, reassuring presentation of what has been done at national level to tackle the effects of the pandemic on youth mental health. And now I will give the floor to the member of the European Parliament, Maria Walsh, who was not able to be with us physically today, but who sent us a video message. She's the youngest member of the European Parliament working on mental health issues for a very long time now, and who has been advocating in favor of making mental health European priority for the future. I will let her share her policy responses for mental health, and then we will resume our presentations. And I'm really happy, and please continue to flood the chat with your questions and reactions, because we will have plenty of time to address them in the conversation following these presentations.
Good afternoon to you all. My name is Maria Walsh and I'm the youngest Irish member of the European Parliament representing the constituency of Midlands Northwest. I'm very sorry I cannot be with you today, but I'm currently on my way to Strasbourg for a lively voting session with good meetings, debates and of course our voting. From the very beginning of my campaign in 2019, right up until this present day, mental health and well-being is an issue which has remained at the forefront of my political journey. In my role as MEP, I act as a co-chair of both the MEP Alliance for Mental Health and the Coalition for Mental Health and Wellbeing within this Parliament. Both interest groups focus solely on mental health and the well-being of our 447 million citizens, and are key players in expanding the dialogue surrounding mental health across all sectors and sections of the European Parliament, Commission and Council. I will share some takeaways from my work and ultimately look forward to our continued conversation in mental health, as sadly I haven't been able to get everything in this speech, so I'm running through it quite quick. Life before the COVID-19 pandemic, the multitude of citizens affected by mental health was disturbing, due in large part to the disconnect between education, health, economics, how we employ people, social inclusion, and of course, the fundamental basic, poverty. You can only imagine post-pandemic how the mental health challenges for citizens have been exacerbated. We now live in a European Union that has reported that the second leading cause of death for our young people in Europe is death by suicide. The second leading cause of death. We need, now more than ever, a strong political and organisational minded approach to a comprehensive EU mental health strategy, which takes a cross-sectional approach to mental health issues. And essentially what I mean by that is we desperately need to work together now, not later, all of us together. My employment and social affairs report on mental health in the digital world of work addressed the overdue political recognition in the lack of efficient mental health services, supports and investments across each of our 27 member states. It is time to take these issues seriously and re-examine what EU action can be taken and needs to be taken. But to be very clear, we cannot have an imbalance in our member states and how we support our citizens' mental health. We've all seen how employees working remotely and now in a hybrid format and have been crucial in driving businesses' momentum in the progress towards a digital transformation. It's all welcomed. And this momentum might be lost if organisations fail to recognise the strong actions to ensure better mental health at work, be it in remote and nomad style life, in person or hybrid. It is utmost importance that workers can expect a proper level of protection for both their physical and mental well-being. Economic costs for member states and the organisations of mental ill health cannot be ignored. Not only financing reactive care, which is standing at 4% of the GDP, that is 600 billion euros. But we must also address the loss in economic output when we're working and our working force in various forms, if not all sectors, are unable to participate in driving an ambitious labour force. An estimated 12 billion working days are lost annually due to depression and anxiety, costing the global economy nearly $1 trillion. The principle of prevention at the workplace must be formally integrated in policies here at the EU level and also at national and of course at company level. Finally, making your mental health as a young person, and particularly as a young person beginning their professional career, is undeniably important. Mental health has been a silent pandemic in my eyes for many generations in our country and across the EU. In 2022, for our young people, we do not have the time to ignore or continue to silence this pandemic. The positives is, though, there is a growing awareness of this amongst MEPs in the European Parliament. And we've heard from our President of the Commission and Health Commissioner that an EU Citizens Dialogue will take place next year on mental health. This is progress. It's slow, but it is moving. Personally, I remain committed to bringing awareness to this and continue to find better ways to take proactive action for each of our mental health and our well-being. I want to make sure everyone is included in this conversation about mental health. That includes all genders, backgrounds, ethnicities, ages and religions. We all have mental health, therefore each of us should have our concerns, big or small, heard and valued. My European colleagues and I intend to adopt this mindset every step of the way when addressing the mental health of our young Europeans going forward. Living with and managing a mental health issue is no easy task, particularly when you are beginning to embark on your career or further study. There can be a fear of judgment and stigma. So many don't share what they are going through. But one thing which is important to learn is that a problem shared is a problem halved. Once you reach out for support, the burden can feel a little less burdensome. I hope you all have a great meeting today. I hope to join you next time. I'm sorry for not being there in person now. Thank you for including me, and please continue to grow your awareness of mental health.
Thank you for this illuminating report coming from the European Parliament member Maria Walsh. I think it's enough to draw the conclusion that mental health conditions are widely spread among young people, that some societies and some social protection systems, or even some institutions like educators, like workplaces, like parent children associations and so on, do not give mental health the importance it needs. We can already draw the conclusion that a comprehensive approach to mental health is needed, and that mental health needs to be better acknowledged, better addressed in our policies. And I will now give the floor, a very tough point to follow, to Giuseppina Tucci. She is the Secretary General of OBESU. She will present the students' perspective on mental health and what, in her opinion, is a potential vision for making mental well-being a reality for every young generation. And maybe she can also refer to what has been mentioned already, linked to the impact of social media on the mental health of young people, and how this is affecting younger generations who are becoming more and more a consumer rather than a producer of media content. Giuseppina, I don't see you, but I know you are with us. Yes.
Yes, I'm here.
You have the floor, and please drive us to a more solution-oriented perspective to the conversation today. Thank you very much for joining us.
Thank you. And what a task. Also, I don't know, I am a person who personally struggles with anxiety, and this first hour has been very triggering. So if for any other of you this has been a triggering hour, let's take a moment to take a breath and remember that we're here together to try to find a solution or a discussion, because it's been an hour that I was like, oh, mama. Whew. So I think it's okay to breathe it through. So if you're having my same situation, let's take a deep breath in the meantime and see where we can go from there. And now let me tackle upon, let me go back to the triggers and try to discuss a little bit, as Raluca was saying, about education, solutions in education that can also be applied otherwhere. I think I'm going to start from the school perspective and the school scenario. This is the one that I know the best, but I think it's, I mean, as it was said before, we have to take a comprehensive approach, so that can be an approach that can be applicable to other sectors, to work, as well as to generic way that we look at mental health. So education, we said it has been one of the most impacted sectors with COVID-19, with the closures, the schools closures. The schools closures, some people say, have created a broken generation, a generation of people that for 3 years has been unable to have social contacts, unable to live out of their online bubble, and unable to survive and develop, let's say, well, in a just, fair, and also generally like healthy way. And what this has meant is that right now we have a complete lack of social competencies and socialization opportunities. And I think that calls already for us to not have only an approach based on services. It was mentioned before, I think Manon mentioned it, like this comprehensive approach. We can look at services, of course, but we need to look way beyond. And this gives for me two ideas. On the one hand, you have, it's like schools. So schools are a very good example, as I said, because of the fact that they reproduce the same dynamics you have in work, for example. Schools right now, from a very early age, are performance-based. That means you go into school and you start a continuous competition of being the best, getting the best notes, performing well in that standardized test, getting into that good school, getting the recognition you need to be able to go well. And this continues into work. You go into work and you have to perform, you have to deliver. And you live with this constant pressure on your shoulders that this is what you have to do. And that has, in COVID, has been even harder, because you have to prove that you're very good when being outside of the classroom. And that has created more isolation, etc. And we have really not adapted our evaluation and our assessment ways. You used to do tests, and you did tests online, and the impact it has on your mental health is very difficult. I mean, first of all, we have a very strong position in Obesu about the fact that assessment, as it is right now in education in general, is very detrimental for mental health, and it should be radically changed into something that empowers students to also self-evaluate. And then you had in schools an even worse situation, which is the one of apprentices that many of you might know, and students in vocational training. This has been even, the impact on apprentices has been even stronger than it has been on some students. They have been thrown out of their workplaces. Sometimes they have been left alone without any proper supervision in their homes. Sometimes they've lost access to their equipment. So it's been very disruptive, and it has an impact also, as we said before, the housing crisis, etc. And many times it's like, look, this is what you have. Now we cannot provide you a school psychologist, but we can provide you with an access to headspace. So don't worry, that is going to solve all of your mental health problems. And I think this is clearly not the way forward. I mean, we really have to have a more comprehensive approach. And as Manon said, we need to go back to the root causes. We cannot, of course, we need to look at access to services, and we need to have free quality services for every young person, and not only young person in this world. We need to start from young people when they are very young. We have children with severe mental health problems right now because of the way schools are done. We have people who go into middle school with already severe performance anxiety that has an impact throughout their life. So this is something we have to do from when they're very young. But it is also costly, and way more costly, to have to provide services that are not preventive services for everyone, rather than just changing the approach we have to the way we do our things. I think there are some things already in the making. For example, the Pathways to School Success initiative in the European Commission right now seems to have a little bit of a better focus on mental health and on creating a whole community approach. There was a question on parents, and I think schools are not in a vacuum, you know, like in the end of the day, one solution that we have to move forward is to have this, to act together. Maria Walsh said it also in her speech. We need to look at the school as composed of 25 different stakeholders that all need to work together, be empowered enough to work together. We cannot dump it on teachers. I don't know if any of you are teachers, but imagine that because this is also what people say and policymakers often say, teachers are not trained to respond. Yeah, but teachers already have their own mental health issues, poor pay, high workload, very many students in one class. The solution is not to put it on one stakeholder is to find a better solution altogether. So I think this multi-stakeholder cooperation is really key in finding a better solution for mental health, and in how we can create mental health policies that are intersectional. It is not only if you are a person from a disadvantaged background, this is not most likely your only cause of disadvantage. You might be a woman, you might have a disability, you might not have a compute. Like, there are so many different things that pile up together that having an intersectional approach in mental health policies, I think it's extremely important. And speaking of solutions, I think we need to move from short-term solutions, from the headspace solution, which is really not my enemy. I mean, of course, let's use meditation as a tool, but, you know, like moving away from an app to a more comprehensive community-based approach that looks at the root causes and tries to change it. The National Recovery and Resilience Plans, for example, they are a tool. If civil society was properly involved in their co-creation, they would have been a very strong tool and opportunity to leverage funds for mental health in general, to leverage funds and, let's say, cooperation between member states on how mental health services must be governed, shaped, created as quality and free services that do not create a burden on the providers, because we also cannot expect to have a service of public mental health services that is not properly funded and relies on the workforce we have right now. We need massive investment in training, and we need thousands and thousands and thousands of more mental health practitioners into the public workforce. And this would have been a very good source of data collection to analyze trends, monitor and evaluate the services, go together. But unfortunately, we missed the train. And maybe it's time that we try to keep a better, also an approach in hard policies can talk of mental health. Mental health is not something, it's a crisis that we need to tackle with hard policies, with economic policies, with any policies. It really needs to be mainstreamed throughout the line. And maybe just to touch quickly upon this issue of social media, I think social media have been both an enabler, a catalyst for awareness raising, and a very big enemy and is a very big enemy for young people. On the one hand, I don't know how many of you are on Instagram or TikTok. I'm sure many of you. And when you scroll, there are an incredible amount of TikToks on mental health and on people struggling or sharing their coping mechanism, or just saying that they're having a problem and they need the community to support them, which I think is the power of social media. And then you have the double-edged sword of many people commenting and creating and reproducing more and more stigma, and then, cyberbullying, and going into this loop of, you try to do good and you end up being worse. So I think there's a balance to strike there. I think we need to be able to use social media. We need to give media literacy and social media literacy as much as possible, We need to be the ones who use it and who use it positively to share support. Although, I mean, not sorry, but none of us are the TikTok average user, I have to say. But yeah, I think we can do much. So we can do both as practitioners, we can support, raise awareness, and continue to push for stakeholder involvement. And at the same time, really push for hard policies to continue developing in that way. Pathways to School Success in schools is a good way forward. Let's do it at work. Let's really focus on, for example, work internships. Let's ban unpaid internships, which is a very big cause of mental health issues. Let's work to really bring mental health to the same level of physical health when it comes to the people's concern on it. And I think I went over my 7 minutes. I'm very sorry about it. And I go back to breathing in and out, if I manage to mute.
Thank you, Giuseppina. And indeed, maybe we should have started with this disclaimer that this is a safe place for everyone, although we use the digital means to connect, which is maybe less beneficial for our mental health. It still puts some specific boundaries between us. It's lunchtime, so please feel free to drink or have a bite to eat. We are here to look at how the situation is and to become more aware of what our role is in different capacities and how we could work together for a common goal, which is mental well-being. I will now give the floor to our youth representative, Mateus, who will walk us through a little bit on our position on how to make mental health a work priority, and maybe to also find out what have been some German responses to this issue. So from the national policy level. Mateus, you have the floor.
Thank you. Thank you very much. And thank you also for this great afternoon session of this Monday. It's really nice to hear. And also, yeah, as you said, I kind of feel like we're here in a bit of a safe space. So it's very nice and a very welcoming session. And also thank you, Pina, for sharing your personal insights. I think it was also very interesting. And trust me, you're not the only one struggling with some health. Sometimes we are all in the same boat here. So, but against the pandemic and the war in Ukraine, the soaring inflation rates and uncertain financial prospects for the European Union, we still live in the most peaceful, prosperous and healthy and long-lived period in the human history. But on the other side, on the same time, the World Health Organization reports that we are faced with the highest rates of depression, anxiety, and suicide among children and young people between 11 and 14 years old. So globally, 1 in 7 of the 10 to 19-year-olds experiences a mental disorder, accounting for 13% of the global burden of disease in this age group. And we heard it today already, but I still want to repeat it because it's just such a hard fact. Second leading cause of death amongst young people in Europe is suicide. That's just unbelievable. And this is a very worrisome and situation. And as a representative of workers' organization, trade union organization, I call on everyone to raise awareness about mental well-being. And we should all do what is in our power to address it when we can, in our working councils or in other fora and discussions. I was collecting some input from today's session and also what we want to put into a CESI Youth position paper. So you will have already a bit sneak peek, which will be drafted out in the upcoming weeks from our side. So we need a European-wide approach to mental health, a EU mental health strategy across all fields and sectors. We need a better mental health at work with special focus on how to mitigate the stress associated to telework, digitalized and hybrid work. The right to disconnect needs to be better upholded. It is important for all the sectors, including the health professionals, educational actors, and academia, industry, and social partners to have a joint approach to mental health and support services for those going through mental distress is provided. The cost, we heard it today also already, of mental illness is higher than the economic costs of absenteeism at work or the cost of associated with treating the disorder, and funds should be made available for early detection mechanism, preventing and treatment. And this mechanism should be implemented in the working place all over our European Union. Also, we heard today already, a problem shared is a problem halved. So for this to happen, the stigma around the issue of mental health needs to be lifted, and we need to normalize talking about mental health. We need to ensure that mental illness is recognized everywhere as a serious disease, and that health services are available and affordable and accessible for all of us. Despite the variety of therapeutic paths, most young people facing mental illness do not receive any mental health treatment at all. Lack of access to treatment is worldwide a problem, and the gaps are really extreme in some places, especially in poorer countries or more isolated countries. CESI Youth is welcoming the EU Citizen Dialogue next year on mental health and hopes that it will raise the awareness necessary for this topic. The process, as we heard, is slow, but we are moving forward. And I can say that thinking before the pandemic, this topic wasn't on the agendas at all. So when we can say that something positive from the pandemic happened is that this topic is really brought now, at least on the European level, on top. We need to reform the education sector in order to rebuild mental resilience of young people and to address the needed competences for new challenges for the future of work. Also some points from Pina we're speaking here about. And the pandemic left tremendous toll on the quality of interpersonal relationships, which remain the best predictor of quality of life according to the Howard Study of Human Development, which is the largest study on human history. And according to this study, to maintain a high quality of life, we need to optimally cultivate relationships with our loved ones and also take care of our physical and mental health. So we also have a bit of a self-responsibility. Speaking about the German perspective, I also would like to bring in today here is that young people are worried in Germany very much about the energy crisis right now. I feel that the pandemic wasn't such a big topic in Germany as now is the energy crisis. And also to give you an example what the politics are doing, we got every employee in Germany received in September 300 euro as a support for the electricity bills. Students will just get it now in December or even maybe in January. And it's not 300 euros, but 200. So there's already a lag in between how the employees are treated, also young people as a student. I can also say that I'm a member of an advisory board of AXA, their insurance, and we had a meeting last week and we discussed how mental health is treated within AXA with the employees, and they have some psychologues employed within AXA, and what they observed is that more and more employees are looking for appointments with the in-company psychologues, and also young people who are looking for a working place right now actively are asking if there's psychological support at the future potential working place. Because in Germany, we have since a few years a different situation on the labor market. We really feel it hardly now that we have a skilled workers shortage. So companies are really fighting for the best heads, and in order for this, they really have to offer and improve the working conditions. And sadly, also here, only the big companies can compete with this. So only they can really offer this kind of service, and smaller companies not. So I'm also happy to share with you that during this week I will sign as the leader of our German youth trade union a pledge with the German Ministry for Youth, which will connect and rebuild or establish a network of NGOs dealing with the topic of mental health. And we want to try to build up in the next 2 years a network in order to bring up this policy or this topic more to the German policies. Because sadly, right now, the mental health topic of young people in Germany is not yet a very big topic tackled on political level, but I'm happy to see that it's at least on the European level a bigger one. Thank you.
Thank you very much, Mateus, and thank you all for these very valuable contributions. I am very happy to tell you that we are still in time. We have almost 1 hour left for picking the brains of the experts. So I would like to maybe give the floor to the 62 participants who are joining us online. Some questions have been already posed in the chat. I will follow up on them, but maybe there are also participants who would like to take the floor by raising their hand on Zoom and to address their question directly, and also to introduce themselves and the organizations they represent. I don't see hands raised, so maybe those people. Telemachos is one of the people. Please take the floor.
Thank you, Raluca. Hello, everybody. I have a question for Mateus. Hello, Mateus. I know that you have discussions with many young people on a daily basis, talking about their needs and their interests. So based on your experience so far, I would like to ask you two things actually that are to my mind crucial for the representation of young workers in this regard. The first question is if you have the feeling that young people do realize the importance of the mental health issues of our generation, because sometimes I believe that theoretically we understand how important our mental health is, but in practice we ignore it somehow. And the second question, which is related to the first one, is if young people and especially young workers are eager to get involved in activities which promote their mental health and their rights in general, and of course how interested they are in becoming members of trade unions and of course supporting their efforts. Thank you.
Should I answer directly or you want to collect questions, Raluca? But it's up to you. I don't see Raluca.
Yes, I am here.
Okay, so
I think you can answer. Yes.
okay, yeah, thank you, Telemachos. To come to the first questions, if I can observe that for our generation, mental health is important, absolutely yes. I would say that young people can feel it, or many young people can feel it on their own skin, that mental health is becoming more and more important. And there's as a bigger problem, which is also connected to the second question, is to kind of out yourself that you're having some issues, to speak about it openly. And then also this is connected to how much you can get involved into promoting mental health at work or at the school. So I think this is something that we could hear today in all the presentations, that this topic is still kind of to many people a taboo topic, to many young people. And this is why we are meeting here today, and this is why there are plans by the European Commission to speak about the topic and to break the stigma. So I can imagine that in future there will be more young people which are happy to be involved in promoting mental health at work.
I think this is also addressing a question we received in the chat, which was somehow pointing to the fact that sometimes mental health issues are not obvious to the person who is going through them. I'm referring here to the question addressed by Anne Laure Pignard. I'm not sure if I understand it rightly, but Giuseppina, I see you raised your hand. Please go.
No, I wanted to also a bit answer the question from Telemachos, because I think it's a very interesting one, and it brings me back, I think, to two issues. The first one is, yes, young people, I think sometimes they are aware, but if I am aware I have anxiety and I want to treat it, and for me it costs 95 euros per hour to go to a psychotherapist, then at some point I also need to decide if I want to pay the bills or have less anxiety, and then I'm going to try to most likely strive to pay the bills. So, you know, the issue of services comes in very, very strongly, I think, on the one hand. On the other hand, is also about understanding that, I mean, particularly for young people in schools or young people in workplaces, like we spend a lot of hours either in school or in a workplace. So it is also important to stay in a school and in a workplace that is healthy and that promotes mental health discussions, and that kind of, you know, allows you, because you mentioned, like, are young people interested in joining trade unions or in joining activities that promote their mental health? And I think that really depends in a way. Like we see it also with student activism. On the one hand, people have an interest to join or to volunteer, but then again, if it's one more thing on your plate, then it causes you stress. It doesn't help you relieve that stress. If you don't have a workplace or a school that gives you a space to engage, if I decide to engage in my school, but then my school is punishing me, or I have to work 3 more hours and I have to take it out of my sleep, then why would I engage? Why would I do this to myself? And how many, do you know how many people left in COVID times, activism, student activism or youth activism, because of the fact that they couldn't handle spending more time online or not meeting the people, that this added value of socializing. So I think we need to be very aware of it. And speaking of, I think I saw, because I'm a very TikTok generation person, I saw a TikTok the other day that I think was very enlightening on this point of view. Like there was this two people and then there was a manager, and the manager would come in and say, look, I know you're very overworked. Everyone is very overworked. And here at this company, we really care about your mental health. And so the other two people start going like, so you're giving us more money, you're giving us less time, less tasks. Are you hiring someone new? Are you going to do this? And then the manager goes like, no, I'm organizing a webinar on mental health that you should join. And if you don't have time, then you can join during your lunch break. You can recuperate work during your lunch break. And then I'm like, this is also why people don't engage in mental health activities, because we make them not tailored to the needs of the people. And then we think that it's an easily solvable thing, but actually it requires very complex policy solutions. So I think young people are aware, and I think refusing care for young people suffering from mental health is a very big issue, but it is an issue that is the role of member states to uphold. They have to provide opportunities for me to go to free therapy sessions that are not in 7 years. Because, you know, I could also benefit from free one, but the next appointment with a free psychologist is in a year and a half. And I mean, a year and a half, I don't even know if my anxiety will have developed or have solved itself. So, you know, like it's a matter of accessibility and timeliness of processes, because I think we have a problem in our societies. We see only suicide as the thing we need to help. And then we always get there very close or too late, while we don't tackle it with a systemic approach. We have 25 helplines, but if you call a helpline saying I'm having a panic attack, very few people can help you. While actually this might be necessary and needed all over Europe. So voila, I just wanted to share also this.
If there is no other hand up, I would like to follow up on this and maybe address my question to Ms. Paolini. Giulia, the report that you have produced is a very important first exercise on mapping the initiatives that member states have taken to address mental health of youth at national level, but I was wondering whether there is any also indication on levels of investment made, if they're correlated to national strategies on mental health, and lastly, if there is foreseen a new edition of this study, or if it will be a yearly by research activity that you will engage in order to see the effectiveness of the measures. Because when I was skimming through the report, I found it interesting, but it showcases some good practices, but we don't actually know how effective they are, and if they really cover this gap which has been identified by research so far on addressing the mental health. We know that from national level, the issue of mental health is very poorly addressed through national instruments. There is very little investment made. There are very few countries who have national strategies on this. So my question would be, to sum it up, if the report will be if this exercise will be made again, and if you will also look at the effectiveness of the measures.
Yeah, thank you for the question. First of all, there is a lot of information that we have on the website of the Youth Wiki. The Youth Wiki is this network of national correspondents that have collected the information for our report. So, and there is a platform, a website, the Youth Wiki, where you can go and refer to all the information collected. It is divided by fields, and there is also a field on health, youth health, that also includes a section on mental health. So that you can go and check, for example, which countries have a strategy, what kind of services they have put in place. It's not relative to the time of the pandemic. This is a general information that is updated year by year. So the update that our national correspondents are doing at the moment probably include the measures that have been put in place for the mental health of young people over the past year. So there you can find a lot of information. As far as the monitoring of the impact of these measures is concerned, we do not look into that, because what we collect is basically the regulations that are introduced. So we do not look at how the impact they have on the actual population, but whether there has been a policy initiative in the countries to address a problem. So unfortunately, we don't see the other side of the coin, but we can say that in general, there has been initiatives in the field, although we don't know how far they have gone into solving the problems.
Have some technical issues. But thank you very much. I understand that each research endeavor has its limitations. I think it would be interesting to bring this perspective up in the future as well. And I think there was one question on the role of family and as a support system. I'm sorry, for me the Zoom is not working anymore, so I think maybe one of my colleagues should okay, now it's working again. I apologize. So please, Prince, if you're still with us, maybe you can address the question directly to one of the panelists, and maybe then Klaus. So I see, yes.
Yes, hi everybody. I put it already in the chat, but just a question to Mateusz, because you always have good example also. I mean, if we speak, for instance, of psychological, financial assistance of trade unions, the provision of skills, the education to work transitions, and I think there are some what we criticize sometimes also from a trade union perspective is that trade unions, that's a feeling we have, could be more engaged in how could I say, in the assistance and support also of younger people when it comes to the transition from education to work. And we still have the feeling that very often trade unions, they say we represent the interests of our members and that's it. And to hear a little bit here from Mateusz, but maybe also from Giuseppina or Fatima or Manon, after what I heard from you, how could you see, how do you perceive the role as we speak about, let's say, holistic approaches where everybody should play his or her part? I would like to, if possible, Mateusz, to hear a little bit on something on this question. Thank you.
So if you allow me for a minute dreaming big without knowing the finances of trade unions, I would love it if we as trade unions, and as you said, not only representing the members, but all workers, would be able to offer this kind of psychological support for the working places. But knowing the reality, I know that this will not be possible from the trade unions. But something that we should really ask for, and I'm just thinking next month or in January are starting the bargaining for public service in Germany. We could ask in the bargainings for psychological or mental health support at the working places, because at the end it is the duty of the employee to take care of their stuff. It's not the work of the trade union. We are more to fight for better working conditions and also to give them juridical support. But taking care of the well-being of the staff is still the primary task of the employee. So, but I would love it if we we could support it, but something more that we could do as a trade union is really bringing this topic up, raising awareness, and also offering some kind of we have academias within our trade unions, so why don't we offer their workshops and trainings, maybe how to support mental health and well-being on a personal side to our members. This could be an idea for us as a trade union, but definitely raising awareness of the topic and bringing it up.
Maybe Fatima would like to follow up on this and tell us a little bit on their campaign on making mental well-being in the workplace a priority. You focused your presentation on different levels like prevention, empowerment, and maybe repair. We lastly talked about repairing mental illnesses, but maybe the focus should be on what Mateus said, raising awareness, prevention, and creating positive workplaces for everyone to feel accommodated, well performing, Giuseppina, and inclusive. So maybe you would like to follow up a little bit on this from your perspective as Mental Health Europe?
Definitely. I think just to follow up on what Mateus mentioned, mental health in the workplace is extremely essential. And this is really tailored around, ensuring that it's a safe space is created to discuss mental health, but also ensuring that there is an exchange of information on what mental health and adequate support in the workplace looks like, and ensuring that this is integrated into the system. So ensuring that there is support and processes put in place to provide relevant and adequate support that reflects the needs of the workers. And in terms of Mental Health Europe, indeed, we do have a focus on employment and mental health in the workspace. And this is definitely an area that needs more focus and attention, and also a sharing of information as well in terms of what adequate support looks like. But there is a resource that I will share in the chat that we actually have, which includes principal key recommendations regarding mental health in the workspace.
I am looking at the chat, and I see that there are many very insightful comments, but if anyone would like also to raise a question addressed to this wonderful panel of experts, please raise your hand. If not, I don't see any hand raised. So in this case, for example, I would like to address a question to Manon. And for example, maybe you can put in a snapshot what are the claims that the European Youth Forum is making towards addressing youth mental health among member states.
Thanks, Raluca. I mean, it's a bit difficult to put a snapshot, I think, as always, because as I was saying before, I think that there's two ways to think about it. So there's the kind of short-term immediate response, which is all about ensuring, access to, the access and the existence of quality services, free services for young people on mental health all over Europe, and of course more, but we look at Europe as the European Youth Forum. I think that's been addressed also already by Giuseppina, Fatima, and everyone in this panel on the need for those services and this safe space in a way. But then there's the other part of this, which is all about the comprehensive approach, and that's where it's everything, right? Everything that betters the life of young people and people in general is going to have an impact on their mental health and is going to have a positive impact. So it's maybe flipping the reflection on making sure that no policy that is taken at the EU level or national level has a negative impact on young people's mental health and well-being. I think that's maybe how you need to look at it. And in that sense, something we've been also advocating for has been a European Youth Test, which is an impact assessment tool looking at all the policies at EU level or national level, and making sure that there's involvement of young people from the start. So, through the design of it, the implementation and the monitoring and evaluation, and making sure that this policy is going to have only a positive impact on young people. So that's a way also to guarantee this in some ways.
Sorry, Raluca, I know that we experienced problems with your Zoom. Tiago wants to ask something, I see.
Yes, but I believe Naimaka raised first and already posed the question in chat. So if wants to go first.
Yeah, okay, may I? Can we all hear me?
Yes, yes.
Oh, okay. So, yeah, first I would like to say that I appreciate all of us for, contributing our time and energy and resources towards this discussion, because if no one is talking about it, then it becomes increasingly difficult to even start to think about solutions. So for the fact that we are talking about it means that there's hope for the future to be better, because it's our responsibility in our time to ensure that we try to put foundations in place towards ensuring that the problem is solved. However, it's an ongoing process, and it's something that we'll continue to recall, and we have to reinforce our commitment towards tackling it each and every other day of our lives. However, to my question, I asked, that could the decline in the rate of family structure be one of the root causes towards the mental health issues the youth face? Because the family, as we know, remains one of the primary healthcare or caregivers to young people. So it's an open question to all of us. We could try to suggest opinions that might be helpful. Thank you.
Can I try?
Yes, please.
It's a very hard question. So I think families are a bit the same example I put on the teachers before, it's like it's the role of family are caregivers. But I think we also need to remember that specifically when we talk about young people, there is other things that come at play when it comes to relationship with family. And sometimes that's exactly the place where the root cause of mental health problems. And maybe that's just because of the way we think about family and the expectations we put on family. Maybe it's about the fact that we expect a certain family structure, and then that creates expectations that we work on, and then creates issues. I think it's not necessarily the decline in family structures. I mean, there's a general decline in structures overall in society. Like we're deconstructing ourselves more and more as the time passes. So I think structures are never really the problem. I mean, I guess we need to look at it for a more complex perspective and intertwine it with the rest of the relationship. I wouldn't put the burden of mental health on families. I don't think, as I said, families are caregivers. I think they play a role, but I think what we need to do to be able to shift a bit the mindset is, what Fatima was saying, like empowering the individual to be the main stakeholder of their own health. Nobody else has to be responsible for my mental health. I also cannot be responsible for my mental health alone, but I also cannot be only my family or only my teacher or only my workplace. It's a very complex network of relationships that we create. So I think what we need to do is have school systems, work systems, youth work, etc., that empower us all together. So in cooperation, to be the main stakeholder in our mental health. And then families, of course, need to be trained, because families can be, as I said, it's the same before as with social media. They can be an enabler or a disruptor of mental health. They can either promote stigma and unwelcome someone with a mental health disorder, or they could actually empower them to take action. So I think this is something, and I see Fatima maybe can complement better than me. I'm not a professional, or I don't work on this specifically, but these are just 2 cents.
Thank you, Pina. If it's possible, I'd love to add a couple of points. But Pina really explained and put forward some of the key points that I wanted to also share. Indeed, I think family is important to incorporate into this discussion, especially around youth mental health. We work with Mental Health Europe also has family representative organizations as part of our members. And this is extremely important because, as Pina mentioned, families can incorporate protective factors in regards to young people's mental health, or risk factors in regards to their mental health. So it can go either way, but it's important to discuss the role of families and also the general community around young people. So we know that often young people rely on friendship groups, family, and the external supports, and that can also connect to social media communities in regards to discussing opening up about their mental health, but also discussing solutions and also common challenges and gaps that exist. So these are all important, and some of the solutions, or in terms of connecting the dots between families and young people, could be, for example, ensuring that there's more spaces for intergenerational dialogues, ensuring that we discuss, as well as focusing on young people, but also those that are not young, when discussing about mental health, connecting the dots between families and young people and parents, for example. This is all very important because, some of the risk factors may not just be one, but that they differ. So ensuring that these consultative processes are in place to discuss what are some of the common challenges, but also what can be done better, and how can the mental health support systems in place reflect the needs on the ground. So I'll stop here, but I think it is important to talk about family, but I don't think that should be the sole focus. And we should definitely consider all components to a community around young people that impacts their mental health, and what we can do better to bring that to light.
Thank you, Fatima. It really takes a village to raise a child, and maybe we still need for that inner child in all of us a village around, and maybe that's one of the scars of the pandemic that we are facing, that the community has disappeared and it left us a bit alone, but alone to realize big important things that we need to tackle further. Tiago, you also had a question. We are very curious to listen to you. And maybe you can already address it to one of the panelists, or if it's just a reflection.
Yeah,
also
thank you,
possible.
Haluka. It's a bit of both. First, I would like to thank you to CESI and the European Youth Forum for organizing this very fruitful exchange. Secondly, I would like to pick up on a few points that the speakers already mentioned. Completely agree with Matthews on the fact that before the pandemic, this issue was not very much into the agenda, and we've been trying to raise awareness of it back since before 2020 and 2020, when was the year when, for instance, the European Sports Organization, including the youth independent body, ENGSO Youth, issued a policy paper on the need to promote the mental health of young people, especially related to sports, and also completely agree with Fatima to the need to provide young people with mechanisms for their meaningful and continuous engagement and involvement. And this was actually also one of the recommendations that young delegates during the European Week of Sport raised, this within the framework of the Healthy Lifestyles for All Youth Ideas Labs, the recommendations on which the young delegates also addressed the need to tackle mental health, and also the burden of the digital spaces that they have in young people, and also completely agree with Julia regarding the lack of policies at national level regarding to tackle, or at least to address the importance that, for instance, sport can play into this team. And now going to my questions, I have two questions for all the speakers, or for whoever would like to pick up on them. The first one will be what's the role they see that sport can have in sport and physical activity. When I speak about sport, it's in a broader perspective of sport and physical activity. So what's the role sport can play in mental health and in assuring mental well-being of not only of young people but of everyone? And in the framework of the announced comprehensive approach by the European Commission, what would be a successful comprehensive approach for you regarding mental health? I mean, pretty much all the speakers already mentioned a few points regarding this, but nevertheless, I would like to hear their views specifically concerning this comprehensive approach to mental health. Thank you.
I don't know who would like to take the floor. Maybe Fatima, because your motto is, and Mateus. Mental Health Europe has the following logo: no health without mental health. So maybe you two can pick up on Tiago's intervention.
I would speak for the first question, if it's okay. I think there is enough research proved that sport is great for health in general, so we don't need to discuss this. But maybe we should discuss also, speaking now again as a trade unionist, how much is sports implemented at work and offered at your working place. I mean, I was working in a working place where we tried to have like an active break where you could do some stretching and so on for 30 minutes in your lunch break and so on. But there should be more, like there needs to be like a cooperation of companies with fitness centers which offer easier access or a cheaper access to sports. For example, there could be also some sports counted as a working time during the week. I know that, for example, the German police, they have dedicated in their 40 hours per week, they have to do 2 hours of sports, active sports during the week. So maybe this is something we could try to implement also in other sectors, as we say that it's motivating and bringing new ideas and it's good for the health. So definitely, I mean, sports could be integrated better in the labor market.
Yes, I'll definitely add on from Mateus. Definitely sports is important. We always say exercise in general can support a person's mental health. Ensuring that young people have access to, apologies, my internet connection's not the great, so I hope you can all hear me. Can you all hear me? Great. So ensuring that young people have access to diverse forms of sports would be great. You know, providing the access to unique sports that are not so common. I think that's something that could definitely be pushed for. And also providing the opportunity for sports that is not centered around competition or, you know, being in some sort of a competitive or a sports where an individual can do it for fun as opposed to competition. I think that's also quite important. And also raising awareness around the connection between sports and mental health is something that can be done more, because most people, a lot of people know, but maybe this information is not accessible to everyone. So ensuring that's widely available is important. And in terms of the new initiative around mental health, a number of us have mentioned how happy we were to hear President von der Leyen mention this new initiative. And it's quite exciting. We still don't know a lot. So we're all ears in the next couple of weeks and months to find out more information. We know that it's a comprehensive approach to mental health that will include several initiatives that will be released in the summer of next year. So that's quite exciting. But there are a number of recommendations that, as Mental Health Europe, we think are quite important, and I think many people here will certainly agree. The first and foremost is that it's essential that this initiative works towards a new strategy on mental health with precise recommendations to member states that incorporates, robust governance, and this initiative, not legislative, but we hope that it will at least support to work towards more legislative initiatives. So in the field of mental health at work, and also ensuring appropriate financing. We also push for cross-functional collaboration between the different directorate generals, the DGs. We all mentioned here how mental health is a cross-cutting topic, and that it really requires an approach from all levels to ensure mainstreaming of mental health, but also cross-collaboration. So that's quite important. MEP Maria Walsh mentioned citizens' dialogue. In any dialogue in relation to this new initiative, we need to ensure that persons with lived experience are really centered in this process. Civil societies that represent users and ex-users of mental health services, and also young people, youth-led organizations and young people should also be part of this dialogue from the beginning to the end. And there should always be an update and information in regards to, where have individuals' recommendations been taken forward, and what are the steps that we should await for. So ensuring that information is provided from start to finish and that they're included from beginning to end is essential. Ensuring a psychosocial approach to mental health. So we really push for moving away from a biomedical approach to mental health, which looks at mental health as something that's only determined by genetic factors or is a disease, but really looking at it from a psychosocial perspective, which addresses the social determinants of mental health, and that ensures a human rights approach that promotes non-coercive measures and also deinstitutionalization, and ensuring that all of these are quite important when taking into consideration this new mental health initiative and what dialogue and collaboration through equal partnership with all stakeholders, including and especially persons with lived experience. And that's what we hope to see. But we will await for more information. We've shared these recommendations, and we hope to see it come to light.
I will need to leave. If I can just jump on board super quickly on the issue of sports, because I really appreciate the contribution from Fatima compared to competition. And I think ANGSO Youth is one of these good practices also of like how sports can be a matter of inclusion and not of exclusion. While, for example, in the formal education system in schools, very often the hour of sport is the most annoying, and meant like it's very hard to go through that hour where you are pushed into competition, judged for your body. You foster fat phobia, you foster exclusion of people that are already excluded. There's no other alternative for people, for example, with a disability. It's not that they cannot move, they cannot do any sort of sports, and then you make them do theoretical things on the body. Is like, this is really not the same as, so I think the formal education sector needs to speed up at an incredible speed to catch up with what civil society and non-formal education has been doing for many years on the topic of sports. And as I said, this is the part of this comprehensive approach. Like, you cannot ask a school to become more inclusive on the way they do sports education without including sports education stakeholders and youth ones that practice it on a daily basis, you know. So I'm pretty sure, and like it's again a double-edged sword for me. Sports can be a very good catalyst and can be a thing that movement in general, or anyway, like, you know, it's also a way to socialize, it's a way to move, it's a way to, you know, many different ways, but it cannot be a way to perform once again. So it can also be this double-edged sword that actually fosters stigma rather than solving it. So I just wanted to leave my 2 cents on the bad picture in schools. But I know that outside of schools, there are many positive pictures of what is actually practiced. So yeah, that's it. And then I will say 2 more minutes and then I will abruptly leave because I have to jump into another meeting. But this has been very interesting and fun. So I'll just, if you don't see me anymore, I mean, not that you care particularly, but it's not that I didn't care. It's just that I have to go somewhere else. So thank you.
Tiago,
Can I
yes,
just
please.
jump in? Yeah. Well, I care a lot about you leaving, Giuseppina. So I'll try just to give two points, specifically on the issue that you addressed on the extreme stress that currently our educational systems, but also our working environments put on us, and this incredible stress lead to us to work and study for longer hours, and therefore take us the time for us to engage in our mental well-being and physical well-being, and therefore we take this time into our tasks at the school and at the work, and therefore we cut it in the time that we would be practicing physical activity. And also touching upon the root causes of this problem that Manon addressed at the beginning. For instance, specifically touching the energy crisis, this would also and is also having an impact on, for instance, sports clubs at grassroots levels. Sport clubs that with this energy crisis will and already are facing a lot of pressure to close doors, and therefore another space where young people and their families would go to practice sports, not on a competitional level or even at a competitional level, but also for recreational sports, would close, and they will see those spaces shrinking even more with this energy crisis. Yeah, just these 2 points. Thank you.
Thank you very much. If there is no other question, I will move to or comments. Please feel free. I'm already happy that I see so positive connections being formed between the participants in the meeting. I would like, first of all, to thank everyone for their contribution today. I think it was a very useful and productive meeting to raise awareness on the issue of mental health in general, but through the perspective of youth, because unfortunately they have been more affected than other age categories. I think that we didn't put the finger on it, but we went around the topic of having a change in the mindset when looking at the mental well-being. Mateus mentioned that we are going through one of the most peaceful, prosperous, and calm period Europe has faced. And despite this, and despite the wealth of knowledge we have on how to make mental well-being a reality for all, there are many limitations. Giuseppina mentioned the different frames, different types of vulnerabilities that people can face, and how important it is to have a mindset which encourages mental well-being at all stages in one's development. Fatima mentioned the fact that a community-based approach to mental well-being is very important. that everyone should be looking at the person and not at the institutions or organizations, but to have a perspective in which the individual is placed in the center and his right to mental well-being is catered for. We received contributions on the importance of school systems changing the way they are performing, the importance of family, teachers, and parents working together towards a collective goal, and of course, workers' organizations, which come maybe at a later stage in an individual's life, but which also play an important role in creating a balanced working space for everyone, in which we can, for example, understand the fact that healthy, happy worker is more productive than someone with different types of problems. We have been advocating heavily on for the health and safety framework in the workspaces, but maybe those frameworks should include also points on mental health. Fatima, you mentioned what the Commission has in store for us in the year to come on this comprehensive approach on mental health. We look forward to joining forces in pleading for a European strategy on mental health. Julia, you referred to the national plans on mental strategies, mental health strategies at national level, but of course these strategies should be I would recommend under a European approach to mental health, with a mechanism of evaluation and reporting back, and with the funding necessary. In the chat, there were many interventions pointing to the level, to the idea that repairing mental health issues is difficult because of the lack of funding. It is true. I think there are different levels of interventions which are needed, and I think when there is serious mental health issues, the national health insurances are covering that, but of course that differs from country to country, and I do not have the expertise to make a claim that this is always covered. I know, for example, that MEP, member of the European Parliament, Maria Walsh, already made the case that investing in mental well-being costs less than not addressing it. So work absenteeism or people falling out of the social system because of mental illness, these situations are much more expensive than making early prevention programs in which mental well-being is advocated for, catered for, and developed for everyone. From our perspective, Mateus, you did a very good job in putting forward what workplaces can cater for the individual in order to improve their mental well-being. And Manon, thank you for your first attempt at bringing this issue up. You were one of the first organizations to flag the link between the pandemic and the scars left on youth. And thank you for highlighting the fact that mental health is so intrinsically linked to the socio-economic conditions that individuals experience, and that an approach to mental health needs to also take into account the multiple levels of well-being of an individual. I don't know if I left anything out. I really think today was a very good exercise to collect this information, these different positions. We will proceed now to writing a summary of today's ideas, calling for a transformational way of thinking about mental well-being at EU level in the workplace. And we will also post this, let's call it webinar, to our YouTube channel, so that other people can refer to it if they want to go back and revisit some parts of it. Mateus, maybe you would like to say the last words. Thank you very much, and we will be in touch for follow-up via email, and I hope to see you soon, and I hope that our plead for mental well-being is heard, and that we have, I see a final remark. Yes, you can take the floor because we actually have 5 more minutes left. Renat? Oh, it was a mistake to...
I think it
Yes.
was clapping hands.
Okay, sorry.
It was clapping hands. And I would join Renate for clapping their hands, because I think it was a great event. Thank you very much, mostly to Raluca for organizing it, and also the colleagues from CESI, but also to all the speakers. It's great to see you here. To be honest, when the topic of mental health of young people came up, I would say in 2020, I was on one side very happy, and also I was on the other side also a bit of feared, like, okay, this is just now like a wave and it will go down. But now, being with you the last 2 hours and hearing that so many organizations are working on it, and that it's really so important for young people, and we really need to bring up the topic more and more on the agendas, that there is no fear, that there is no taboo topic anymore, and that we are having the right policies. So thank you. I'm happy to be with you on board on this, and have a great rest of the week. I think it was a great start of the week, a very motivative one, and yeah, wishing everyone a great day. See you next time. Bye.
Yes, and applaud for yourselves. It's good for your mental health, a sense of accomplishment, and we will be in touch.
Thank you. Bye bye. Raluca, we are using this channel now for the youth board meeting, yes?
Yes, I will just stop the
Recording.
recording.